Welcome to Stanford Institute of Nursing. Get ready for an exciting series where we tackle over 5,000 next-gen NCLEX questions in 30 days. Question 1. Considering the condition of the client, who is experiencing chest pain rated at 8 on a 10-point visual analog scale, along with ST elevation in the inferior leads observed on the 12-lead electrocardiogram and elevated troponin levels, the primary focus for nursing management of this patient should be on prioritizing the following. 1. Educate the client on prescribed medications and dietary recommendations. 2. Assess daily weights and urine output. 3. Implement measures to alleviate pain and reduce myocardial oxygen demand. 4. Permit unrestricted visitation by family and friends. Correct option 3. Implement measures to alleviate pain and reduce myocardial oxygen demand. Nursing management for a client with a myocardial infarction prioritizes pain management and reducing myocardial oxygen demand. Close monitoring of fluid status is essential. Once the client is stable and receptive to teaching, education on medications, diet, and lifestyle modifications can begin. Visitation should be determined based on of the heart. Question 4. What are the desired effects of intravenous morphine sulfate for a client with acute chest pain? SATA. 1. Alleviates anxiety and fear. 2. Promotes a decrease in respiratory rate. 3. Lowers blood pressure and heart rate. 4. Prevents ventricular remodeling. 5. Reduces myocardial oxygen consumption. Correct option 1, 3, and 5. Morphine sulfate serves as both an analgesic and sedative medication. It effectively reduces myocardial oxygen consumption, blood pressure, and heart rate. Additionally, morphine is known for its anxiolytic properties, alleviating feelings of anxiety and fear through its sedative effects and the slowing of heart rate. It is important to note that while morphine can depress respirations, caution should be exercised to avoid hypoxia, particularly in the treatment of chest pain. Question 5. What instructions should the nurse give to an older adult with chest pain and shortness of breath who has been prescribed nitroglycerin tablets? 1. Chew the tablet until it is dissolved. 2. Put the tablet under the tongue until it is absorbed. 3. Place the tablet between the cheek and gums until it disappears. 4. Swallow the tablet with 100 milliliters of water. Correct option 2. Put the tablet under the tongue until it is absorbed. In the case of a client experiencing symptoms of a myocardial infarction, the initial action is to prevent platelet formation and block prostaglandin synthesis. To address this, the client should place the nitroglycerin tablet under the tongue and allow it to be absorbed. It's important to note that nitroglycerin tablets are not effective if chewed, swallowed, or placed between the cheek and gums.